Hello everyone, this is Eric Crump, home care coach extraordinaire, coming to you with the latest rendition of our fall webinar series, Marketing Annual Wellness Visits to Boost Referrals. So we're going to go into some very specific information about a Medicare Part B benefit, the new annual wellness screenings. However, if you are not a skilled nursing and therapy provider, your private duty or even hospice, stay tuned because you can pull off these events. In fact, you have an advantage over the Medicare providers with this one strategy. Again, my name is Eric Crump. Eric stands for Every Referral is Critical. That plays well when we go out and do our on-site seminars, which we're apt to do. We're getting our 2012 speaking engagement calendar made up. We'd love to come out and talk to your group. We have a ton of information. We'll do our best to give you best practices during a full day seminar. It's very entertaining and informative. It changes the direction of thought, which is the number one step in increasing your business. If you think you can do your business the same way, the same methodology, and have it grow, I want to challenge that. I want you to know that you have to think a little different, think outside the box, and do different things to get different results. You can contact me anytime at eric.crump@theadamgrp.com. That's my email, or call in direct 1-866-232-6477. You can talk to myself or any one of the tag team members here. We're located in Franklin, Tennessee. Your contact information for coaching calls is www.homecarecoachingcall.com. We post all of our past series webinars, and there's a good library of webinars up there now at www.youtube.com/tag webinars. You can also, if you'd like to tweet, I love to be tweeted, you can follow us on Twitter at Tag Home Care and Marketing is abbreviated MKTG, or me personally at Eric_Crump. You can get a hold of us by tweeting. We're located right here in Franklin, Tennessee, smack dab in the middle of Tennessee. And today they keep threatening that it's going to snow, but it's just a cold, misty rain all day today. The snow, ironically, is to the south of us, they say. But usually it's sunny, and we're located right here on the banks of the Harpeth River. We love to have you guys come visit the tag team, visit our facilities and our sister company, our CRM group, Playmaker, next door. We're very proud of our workers and our staff, the tag team we call them. We also host webinars on other topics during the year, so I invite you to keep in touch with us on new topics. We have several new topics. I say several. There's going to be 3 new webinars in the spring series on new opportunities for home care, private duty, and hospice to attract more business. We also sponsor boot camps. We have one, actually, the last one of this year. It's coming up Thursday and Friday. It's where we bring in non-competing home care providers into the tag team setting and just give them a day and a half of concentrated sales and marketing training. They're very powerful. If you need to find out more information about that, go to www.bigreferralbootcamp.com. Your agency's event opportunities. So today we're going to talk about event planning as a marketing strategy. And you know, if you know anything about tag home care marketing, that we separate marketing and selling. We think marketing is a way to get your message out to the community, to get your message known, to become favorable status and you're top of mind to your referral sources. They want to think about you and quality and your outcomes. However, selling is a different creature. Selling requires top-of-mind service and going and backing it up with benefit statements and going and winning over the referrals one at a time. That's what we do in the business. We're always asked to give them quick fixes on how to increase your referrals and revenue, there are no such thing as quick fixes, not the ones that last. You have to have a managed productivity model that works, and we could help you get there. Part of it should include inroads into event planning for two reasons. Nothing can ever relay in print what you can relay in person through a live event. And second, the growth of referrals through planned events is a beautiful thing. It's not the pressure sell. It's apart from the normal tug and pull of comparing ourselves to our competitors. When we're doing event planning, we're bringing our referral sources and our potential client base to us through benefit by offering them, in this case, annual wellness visit screenings, but in other cases, information about dementia and prevention of abuse training, fall prevention, any type of an event that you want to put together. They're very, very effective. It adds value to your customer. Your agency should sponsor a community event that brings value to your customer base at least once every quarter. We're firm believers in that. It's a no-brainer. And with all sales reps, we say you have a day job and a project job. Your day job is to call on those referring sectors that will yield the best results. Stay top of mind with your A accounts, open up those B accounts, bring them into A account status. However, you need to have some mojo, some community cheddar out there, some influence. You need to brand yourself as a quality provider and be tip of tongue, top of mind. You need to brand yourself with your local service community. There's no better way than to conduct your own events. There's no collateral benefit in attending other people's events. Let me say that again. There is no value in you buying a booth under the guise of someone else sponsoring an event. The exposure's not worth the cost. And if anybody can show me where they made money and a decent return on investment by attending other people's events, I'd love to see it. I've never seen that happen. So what I'm challenging you today is think outside the box. Create your own events. Create your own cheddar in the marketplace where people want to come and see what you have going on next. That's how you elevate your marketing approaches to your own service area. And the strategy of event planning is all about consistency and having a controlled agenda. In other words, you're calling the shots. You're not bringing in 3 other competing agencies to compete with the noise and see who can talk the loudest or who can have the biggest voice or who has a platform, because a lot of situations you run up against competitors that have more community influence than you have just through their history and being in the business longer. So you want to do your own events, you want to control your events, and you want to get your message out the way you want it to be perceived. 2 mistakes to avoid in event planning. First of all, the primary agenda for all your live events is to achieve an acceptable return on investment of resources, right? There's too many home care agencies directing monies toward dark holes, chasing what your competitors are doing. I want to throw this at you. What if your competitors are wrong and you're copying them, what they're doing every day? What if what they're doing is not working? How can you even track how effective it is in what they're doing? I say all that to say this. Go your own path. The people that reach success the quickest are the people that go through their failures the fastest, right? Every event you put together is not going to be a success. However, you'll know, and not to repeat the same mistakes. That's how you know you're on the step ladder towards success. 2 biggest mistakes home care companies make is they attend events of other providers and agencies. Again, I challenge you to show me where you made your money back. It's just like calling bingo, dropping off Christmas baskets or donuts or lattes. Show me where you're making your money back. I'll believe it. If it was that easy, we would all do it. The second mistake is they attempt to run every aspect of an event, which drives up expenditures. I always say if you get 3 people, if you take a good idea, it only takes 2 people to kill it. Because as soon as they get in there and they start tugging with one direction versus another, or God forbid you get 3 people in a room, it almost kills an idea. Because we tend to expose ourselves to the details. There's different ways. And think about the return on investment and how cost effective it is to go out and bring in a fully packaged idea and try it. If it works, try it again. Try it bigger and better. If it doesn't work, never try it again. But that's how you should go through these ideas. These things that, and I don't know why it is in home care services, we want to do it all ourselves, right? Because in our core, we are service providers. We provide the most personal service there is in the home settings, the nursing and skilled services and non-skilled aid services. So we tend to approach everything with that same model, and it's incorrect. We should outsource this stuff to experts. Live events work. I can send you collateral proof that there's several companies that we've had as branded different events in different markets and have been really, really successful. What I can't do is I can't foretell whether or not your event's going to work in your area. There's a lot of variables specific to every location, every territory. So I can't put a money-back stamp guarantee that you're going to go out and do a pastoral breakfast and every pastor's going to show up and everybody's going to love the presenter and love the quiches that you served and you didn't run out of orange juice and the coffee was not hot enough. All those things are variables that we have no control over. What I'm telling you is live events work. We have several agencies in hospice, private duty services, and skilled home health services that have garnered tons of referrals and revenue by taking advantage of just our senior luncheon campaigns, where we send out postcard mailers and invite them to hear a guest speaker and provide lunch. Here locally in Tennessee, we've had 17 direct Medicare referrals result from a live senior lunch campaign. Now that's anecdotal. We've had some that only produced 3 and actually didn't pay for them. The event didn't pay for themselves. It was more of a marketing and branding effect. However, if you never try it, you will never know, right? We also coach agencies on hosting half-day and full-day senior seminars, quarterly pastoral breakfasts, and all these things can be done with little or no out-of-pocket expense. In other words, why would you try to reinvent the wheel when you have home care sales coaches who will give you the advice for free, give you best practices? It just doesn't make sense that you wouldn't want the input. Today, I want to talk about a very specific event strategy, and it's wrapped around the new Medicare benefit of annual wellness visits. Annual wellness visits, or AWVs. This is a yearly screening visit for Medicare recipients during which they get physical evaluations from their current health status, followed by a plan of self-care from a medical provider. In other words, it's a best practice visit. It's not a hands-on physical, not a lot of labs and other work that can be recommended based on what you find during the evaluation, but this is a consultation visit. So moreover than a physical, this is a consultation. Keep that in mind. So what you'll discover today is everything you'll want to know about Medicare annual wellness visits. I just want to give a shout out to Secretary Sebelius. I know a lot of things have been going on with the finances and everyone's scared about direct Medicare payer sources and how we're all going to be reimbursed and where the money's going to come from and what benefits will be cut or what reimbursements will be cut. Secretary Sebelius made a promise 2.5 years ago to update the Medicare.gov site and put up all the information, start making us report our clinical outcome scores in all different sectors, and boy, she's holding true. If you've gone to Medicare.gov lately and seen the changes just in the last 6 months all the different information that's uploaded. We should be advocates of all that information. We should be part of that healthcare continuum. But I'm also going to show you in this webinar how to seek some of that information out on Medicare.gov. But I want you to realize how you can use annual wellness visits to revolutionize your home care agency's marketing campaigns. Doesn't matter how big you are, how small you are, you can pull off these event planning. You automatically get a lot of community marketing benefit. So it's one of CMS's newest Medicare benefits. The Medicare annual wellness visits are defined and outlined in the Medicare Benefit Policy Manual, Chapter 15, covers medical and other health services, revised in February and then outlined in April. They actually released the new results in April. And there's the website. That's a live website. You guys will all be emailed this presentation, and you can click on that. I'll take you to the manual's website. You just look on pages 253 to 258. You'll see the definition of annual wellness visits and the details about it. They've gone on to flesh it out even further since then. One of the great things about the new guidelines for covered medical and other health services, now they put all the changes in red, which sounds simple, but have you ever tried to read 258 pages to see what was new versus what you already knew? Now you can just scroll through that manual and pick up all the new changes in red. Under Medicare's Manage Your Health section under Medicare.gov, you will see the Medicare preventative visit explain to the Medicare recipient. So if you go under the Manage Your Health tab and scroll down, there'll be a tab that says Medicare preventative visit, and you just click on that, and it'll give you all the information, how it's covered, who's eligible, and this is a consumer-based information tablet, but it's a great place to send everybody who has questions. Also invite everybody to read the new Medicare and You, which is the consumer's publication for Medicare benefits. But we need to stay abreast of all that. And again, if you see under the first star, what's new on page 4, they highlight it in red. What are the new benefits versus prior to the last publication? So one of the ones that they are really touting now is open enrollment. Their dates have changed for Medicare Advantage plans, HMOs, and PPOs. And I don't know if you know this or not, but there is no open enrollment anymore for a 5-star rated HMO or PPO. They can switch over to a 5-star HMO and PPO or a Medicare drug benefit plan anytime during the year. There's no restriction. So we have even more and more seniors converting over to managed care plans, and we're not doing a good job of touting direct Medicare, which is a lot better payer source for post-acute patients. So I challenge you to become advocates and voices in your community to teach the seniors the difference in these HMOs, PPOs, and direct Medicare benefits. Advantage program suppliers are doing a great job of painting the picture of you're going to have that anyway, and this is all the extra stuff you get, which we all know that's not quite the case. However, all that being said, I challenge every home health provider to get their overhead down to the point where they can accept a lot of these managed care programs, HMOs and PPOs, because they're not going anywhere, folks. We're going to have to work smarter. We're going to have to work a different way. Part of that is outsourcing some of our key components and concentrating on what got us there to begin with. That's our skilled nursing and care services. So you're going to have to do some evaluation on who is a money generator in your agency and who is overhead and where can the costs be cut. Under the Medicare and You there's a simple explanation, and you can take any of that information, and we're supposed to be, as Medicare service providers, advocates of all this information and distribute it to our local service communities anyway. So as I said before, annual wellness visits are hands-off counseling visits. They're not the personal preventive plan services visit or the Welcome to Medicare visit. This is a consultation visit. So it's a new Medicare Part B benefit that is essentially a counseling session with individual preventative care plans given to the recipients based on medical findings at the end. So they're going to be given a consultation session by a medical professional, and we'll define those in a second. And then at the end, they're going to get a best practice sheet to go by for the next 12 months. It may include regular checkups or labs or follow-ups to their general practitioner or to a specialist, whatever the medical professional deems is best practice for that individual. Who is eligible? All people with Medicare. If you've got the Welcome to Medicare preventative visit, you have to wait 12 months before you can get your first annual wellness visit. In other words, if you took the IPPE visit, Welcome to Medicare physical, then you have to wait 12 months before your wellness visit is paid for. But you don't need to have the Welcome to Medicare visit before your yearly wellness visit. That doesn't preclude you not having it. You just have to be on Medicare services for 12 months. Your cost in the original Medicare, you pay nothing for the yearly wellness visit if the doctor or other healthcare provider accepts assignment. If you get additional tests or services during that same visit, they aren't covered under preventive benefits, which a lot of them are. We'll talk about that in a second. You may have to pay a co-insurance, and Part B deductible may apply. So, how would a senior qualify? Allowing for payment for annual wellness visits are done when they're performed by a qualified health professional for an individual who's no longer within their 12 months of their effective date of his or her Medicare Part B coverage period and has not received either the initial preventative physical examination, IPPE, or an AWV within the past 12 months. In other words, you've been eligible for Medicare Part B, and it's been either 12 months since you began your eligibility, or since you've had your Welcome to Medicare visit, or since you've had a prior AWV. And since we know everybody's on their first AWV, because they only took effect in April, that wouldn't apply this year. Medicare co-insurance and Part B deductibles do not apply, not if it's on direct Medicare. An eligible beneficiary is an individual who's no longer within the 12-month period. We're just restating this. Part B coverage period, who has not received either the IPPE or an AWV providing PPPS within the past 12 months. And I'm trying, I'm known for breaking this down to a 9th grade level because I consider myself to be a 9th grade genius. So I try to stay away from all the letters and just put it to you in simple terms. So in simple terms, 12 months in, they couldn't have had the Welcome to Medicare visit, and they're eligible. But you can also run their payer number if you are the provider that's actually performing the visit. It's not the same as a Welcome to Medicare visit. It's different coding. The IPPE Welcome to Medicare physical is billed under GO 344. It's not even as much in compensation as the annual wellness visits. You'll see that in a second. As of January 1st, 2011, original Medicare no longer charges out-of-pocket for the Welcome to Medicare. In other words, those IPPE physicals now don't have the mandatory copay. They dropped the copay for that and a lot of other preventative services for seniors. I encourage you guys to start being advocates of direct Medicare out there to your local service area and show them what's available, because honestly, managed care is going out there touting it like they invented it, right? But it's not. It's a Medicare direct benefit as well. So for the first time, Medicare program was created in 1965. Original Medicare now covers an annual wellness visit with a participating doctor or other care provider at no cost. So the AWD, it's similar, but it has a different screening path from the Welcome to Medicare physical exam. They're both coded under the diagnosis code B70. However, it's the recognition of need to educate and reinforce certain things on an annual basis to Medicare patients. So just think of it as a best practice consultation. That's what it's meant to be, a best practice consultation. The initial annual wellness visit screening is weighted geographically, but the national average, and is coded under GO 438, is $174, which is a lot more than a Welcome to Medicare visit, and it's a lot more than a general chronic condition visit to a general practitioner's office. $174 for a 15-minute visit, you can make a buck off that. Subsequent annual wellness visit screenings are billed under GO 439, and the national average across all United States is $111, and these averages are not adjusted for regional geography. So I color-coded some of this. Remember, I'm a ninth grade genius. Physicians' billing information, they might want to know. We did this originally in the late spring, early summer as our one of our webinar series, and it was brand new to everybody. A lot of your physicians have heard about it now. They may not have billed it and may need assistance with it, but a lot of them have gone through it simply because there's been a groundswell of recipients wanting the service, the annual wellness visit. So the diagnosis code, like we talked about, the B70 code, that's a wellness code. The billing criteria, initial billing code is GO 438. Subsequent annual wellness visits are billed under GO 439. Physicians can identify and amend modifiers. As with all visits, even with an office visit, they can put on a modifier of something else, identifiable service that they conducted during that visit. In other words, an EM service, evaluation and management service. The physician can be paid for both services. For example, a patient comes in for their annual wellness visit and complains of tendinitis. You could bill it this way. Under the current procedural terminology code, your ICD-9 code of 726.90, that's in endoscopy of a specified site tendinitis, but it would still be billed under the billing code GO 438 with the wellness B code B70, and then the upgrade modifier with the ICD-9 code signified. Don't you love the way Medicare forces us to bill stuff? It's not that complicated, though. And I always tell home care sales reps, if you want to spend 3 of the longest but most productive, as far as information gathering, hours of your life, spend it with your billing clerk. You need to know what's most profitable for your agency anyway, because you don't know what type of bait to put on your hook if you don't know what fish you're going for, right? But more sales reps should understand more of these coding and the profitability as it applies to home health. There's no copay required. As of January 1st, 2011, Medicare will pay the full amount, meaning that the beneficiary does not have to pay the typical 20% copay. In past years, that's been mandatory that physicians had to bill it, nor toward a yet-to-be-reached deductible. There's no copay requirements for the patients. It's not only this, there's other stuff too. There's no copay now for a lot of wellness visits. We need to go out and we need to educate our market again on direct Medicare benefits of all these wellness visits paid for without copay involved. Because again, your competitors are out there singing their song. We just need to start practicing and get out there and start bellowing ourselves. So there's a lot of suggested components written into the best practice for annual wellness visit as laid out by Medicare. It's recommended that each patient receive an explanation of benefits letter that details the purpose, scope, and benefit of an annual wellness visit. And quite simply, that is just telling the seniors what it's going to consist of, what the payer source is, that it's a Medicare direct benefit, and the purpose of it is to follow a best practice pathway for several years. And the thought is, if a annual wellness visit screening can prevent one acute admission through best practices, it would pay for 41 screenings, which is a phenomenal statement in itself, but that's where we want to go. We want to spend our money more, and Medicare's money more, on preventative measures than post-acute care. There's no future in post-acute care. This letter would explain to recipients the value in having the no-cost annual screenings and how this can be of great benefit to their overall health. So there's certain required pre-visit information. So a patient questionnaire filled out by the patient that lists current medications, the current doctors they're seeing, and 7 specific medical and family history screening questions have to be asked before the patient or client goes in for their annual wellness visit. In other words, you have to set the stage. We have to know a little bit of their history and physical before entering their consultation visit. That's mandatory. Another mandatory component of annual wellness visit is an annual wellness visit check sheet that's used by the practitioner during the visit that reviews the patient's questionnaire information. It contains 8 specific assessment screening subjects with appropriate refers to include the personal preventive plan services. In other words, from the history and physical and 8 specific assessment screening that is done during the annual wellness visit, you create the personalized prevention plan services, or their best practices to leave with. Another required component of annual wellness visits is the personalized preventive plan services, or their best practice template. The direction they're leaving with on when they should get certain tests done. And of course, we have to separate it. A women's preventative plan that contains individualized care instruction would be much different than a men's preventative care plan. But you want to have a version of each. The thing of it is, the tag team's already put all that together for you. We have all 5 required and suggested forms compiled and ready to go, just to be logoed with your agency's contact information, company logo. We've done all the work for you on the required documentation and can even assist in getting the seniors to attend your screening events through our postcard series. I'll discuss this more at the end of today's webinar, but you want to touch the market, all the seniors in the market who would qualify, and inform them, but it's an ongoing thing. This should be a strategy that you repeat over and over and over and become more. I always tell people, remember when it was paid for service before PPS took effect? We would do more wellness screenings then than we ever do now. It's just now we just have parked at the door of the hospital and begged for acute discharges. That's our business anymore. And Medicare has recognized that we're a player in the preventative care plans. We should be a player. We should go out and do all these pre-screenings and instigate some best practices in some of these seniors who are yet to go into an unmanageable chronic state or an acute state. Who can do an AWV screening? It's probably the most asked question when people call up. They say, Eric, can my nurse do it? Well, yes, but there's caveats, and here they are. The annual wellness visit screenings must be done by a health professional as defined in the following 3 examples. Number 1 is the definition of how Medicare defines a general physician, Medicare licensed physician. A physician who is a doctor of medicine or osteopathy as defined in section 1861 Revision 1 of the Social Security Act, or a health professional who is a physician's assistant, nurse practitioner, or clinical nurse specialist as defined in Section 1861, subset AA, version 5 of the Act, or, and this is where the nurses fall, a health professional who is a medical professional, including health educators, registered dietitians, nutritional professionals, or other licensed practitioners, and all your nurses, hopefully, who are out there doing home health visits are licensed practitioners, or a team of such medical professionals. However, with this category, they must be working under the direct supervision as defined in Section 1 of a physician as previously defined. In other words, they have to be working under an A, under the direct supervision, on-site physician. Added preventative services available. I told you that additional Medicare changes provide additional preventative care incentives, and now most people with Medicare can receive critical preventative services, including cancer screenings, mammograms, colonoscopies, PSAs, for free, no copay involved. All that's listed on Medicare.gov. We need to be advocates of this wellness benefit program and stop the bleeding of people leaving direct Medicare, going over to HMOs and PPOs and Advantage programs because they think that direct Medicare has no benefit. Let me put it simply this way. If you're waiting on Advantage plans to tout the benefits of direct Medicare, you're going to die old and bitter. It'll never happen, right? Because it's not in their best interest. It's counterproductive for them. If you want to be direct Medicare to have an advocate, look in the mirror, that would be you. Additional new Medicare benefits. Additional Medicare changes that provide preventative care incentives include the Affordable Care Act will also provide qualifying doctors and other healthcare professionals a 10% bonus for primary care services. So now there's a big difference in managing a chronic care patient versus doing a preventative care action. So we need to wrap our heads around the fact that we cannot survive and maintain our growth tangent solely on post-acute discharges. We're going to have to start looking at the Medicare population as a whole and see where we can fit in and start branding ourselves to the seniors a lot earlier in their health cycle. So, what makes it an event? What does annual wellness visits have to do with event planning, Eric? You're making a stretch here. This sounds like someone stumbling into their general practitioner's office and going back behind the wooden door. The answer is you can reach hundreds of Medicare recipients in your local service area and bring them to a central location for their annual wellness visit, along with other screenings, vendors, education. So look at it as a health fair, and annual wellness visits is part of it. But that's the part that will attract your third-party referral sources, your physicians, the new patient, physician, visiting physicians, your general practitioners, even your hospitalists. That's a pretty good reimbursement rate. So why would anybody show up to this thing? There's no doubt that preventative care physicals such as annual wellness visits are both life-saving and cost-saving for seniors. Medicare recipients are the nation's largest sector in healthcare costs and the risk factors of debilitating disease. In other words, they're called screenings for a reason. You're going to find things, and you need to get that message out. If everybody wants to do best practices, some things are obvious to a clinician that wouldn't be obvious to a layperson. It's the old, you can heat a frog up in water until boiling and they'll never jump out because they're living with it every day. Things that are obvious during a screening for patient care is not always obvious to the patient. Why would people show up? Obvious question 2 is free, and you can serve food and other fun activities. You can make it a social event planning, and most of your events turn into that anyway. That's a great branding event to go out into the community and bring them all together with purpose. What would make a local physician want to participate in my event? Unfortunately, the answer is money. Initial annual wellness screening events, the GO 438 code is $174, and subsequents are $111. That's pretty good reimbursement for a Medicare patient. And remember, they don't have to co-bill. So no co-billing headaches on that. Why would other home care providers or vendors who service Medicare patients want to be part of my event? Because you're going to reach hundreds of Medicare recipients in your local service area by bringing them to a central location for the annual wellness event or annual wellness visit, along with other screenings. You can have podiatrists doing bone density screenings. You can do A1Cs. You can do gait and balance. You can do all types of things. You can do memory care exercises, provide food, activity, and lots of education while they're there. Here's the real world question I always get. Eric, I don't have time to do this. I can't pull this off. I don't know what world you live on, Eric, but this never happens in my world. It's all I can do to go out in the mud and do the visits, or go out in the mud and do the personal care. I have no time nor inclination. So it always, when I get those type of calls, it starts something like, I'm already knee-deep in putting out fires. Our agency has some issues that are complicated and so unique to us that I can't imagine them. I would love to do this, but honestly, if I get off this hamster wheel right now, if I stop stomping on all these small fires in my office, then the world in all its entirety would cease to exist as we know it. I hear that every day. I heard that this morning on a coaching call. Yeah, that sounds good, Eric, but this is the real world I'm dealing with. Well, I hate to hearken on past experience, but I was in the real world, and I know that this can be done. I was in the real world in non-medical services and in skilled services. I'm telling you, this is the easy part. This is the easy part of branding yourself, and the collateral benefit to these types of events is immeasurable. I will always tell you, and when you put on an event, you'll get collateral benefit year-round from it. So my answer is always the same: relax, take a deep breath. No one's forcing you to do anything. If you pass on this opportunity, trust me, there's tons of competitors in home care services. Wellness centers at every supermarket, the Walmarts, they're hooked up with preventive managed care programs. They'll put these together, physicians groups, vendor groups. They'll run with it. It'll get done. Don't worry. You don't have to do it. You'll just be one of the ones on the sidelines watching all the business and opportunity go to other people. And then you'll say, wow, look how lucky they are. Luck has a lot to do with ingenuity and hard work. It's always the case. So we had other opportunities in the past, and I always like to bring this up because this care dynamics, or the flu buster, people sound familiar. It's one of the nation's top provider of preventative health and wellness services with annual sales in the millions. They didn't exist prior to 2002. Or Maxim Healthcare Service now, they're one of the largest home care providers. They started out with flu shots, health screenings, health fairs. Because when we got the flu shot opportunity and we could fit it into a reimbursable marketing idea, we chose to pass on it. Oh, it's not enough money. We make so much money doing visits. Why would I give up my nurses to do flu shot clinics? Well, because the people who had the foresight to actually follow through on it and realized that it was a marketing opportunity as well as a reimbursed activity are now multi-million-dollar, in the case of Maxim, approaching $1 billion healthcare company. So maybe I convinced one or two souls. Let's see how many are on this webinar. I've driven off a good many. There's 71 poor souls left. So can you pull it off? Yeah, you can pull it off. You can pull it off with the tag package at $2,797. And we can provide all these things: the strategy, the attendees, the needed collateral and documents, and the methods to get it funded, and the coaching. So the strategy is the amazing annual wellness planning kit will have about 90% of the entire strategy, including how-to worksheet of best marketing practices and ideas, not only conducting the annual wellness visit, but how to get a great return on investment. You get 30 minutes or more coaching call with your staff by a sales coach, and I take all the annual wellness visits, coaching calls, because I do live in the real world, and I know all home care is local, and there's local exceptions to everything. And I have learned from annual wellness visits that have been done in the past a best practice way of doing it, but I also know some red flags. When you're saying certain things in certain criteria, I say, well, hold on, I don't think that's going to work, and here's why. So we're not going to lead you down with rose-colored glasses. Tag Home Care Marketing can provide the attendees. We send out customized invitation letters to 1,200 seniors in your local community to attend a 4-hour health fair complete with their free annual wellness visit, food, education classes, giveaways, whatever you guys set up. These are the potential clients you can screen and expose to your agency services. So it doesn't matter if you're hospice or non-skilled private duty service provider. This works when you're gathering that many seniors together with purpose. So a 1,200 count agency specific letter campaign alone can bring your agency business. In other words, this is a great marketing tool. If they don't attend your event, you've reached them with this is who we are, this is what we're about, and here's our services. All that would be on your letter. We furnish the custom content, the list of recipients in your area, even the postage with these mailers. So it's 1,200 mailers. If you tried to do a 1,200 mailer campaign, you couldn't do it for what we're charging for this annual wellness visit. It will be complete with your agency's branding, the event location, the description of activities, and even the pre-visit questionnaires attached. How do I document the visits? Tag Home Care Marketing can provide all the needed collateral and documents that you'll need to pull off the visits, the benefit letter with questionnaires that's suggested, and then the mandatory pre-visit patient questionnaires, the mandatory annual wellness visit checklist, and the mandatory PPPS for women and men. All that comes in your annual wellness visit kits. This is what the letters look like. But always know this: when you're dealing with TAG and the TAG team, if you can dream it up, we can make it happen. We can make your letter look like anything you want it to look like. These are our two templated versions. Both are pretty effective. One's emphasis on the wellness care. The other one is emphasis on it being a Medicare government reimbursed benefit. The benefit letters and an attached pre-screening questionnaire will be your 1,200 count mailer campaign. These invitations will be mailed to individual seniors in your local service area. Your agency will also include, or your kit will include, 2 50-count additional customized pre-screening questionnaires. In other words, you're giving either they're attached to their letter or they're filling them out on site, but it's naming those things that is mandatory that they name in the history and physical, their physicians, their current medications, and all 8 of the family history and physical questions. 4 50-count customized tablets of annual wellness visit checklists to be used during the actual annual wellness visit screening by the clinicians. There's certain things they have to ask. And then there has to be a required PPPS or personalized prevention plan services. They get custom individual instruction guides that are mandatory component. And of course there's women's that include mammograms, pap smears. There's men's who include lipid screening, PSA testing. The kit will also contain a DVD of this webinar, along with the slides of how-to best practice sheet for putting together this event. And so, for the rest of today's presentation, I'm going to go into some detail on how to organize these types of events using best practice marketing and sales strategy. All right? So how do you draw the seniors? If you've ever attended a boot camp or a live presentation, and I've gone into community marketing, I have a phrase I'm known for. I'm trying to decide whether I'm going to pull it out on this webinar or not, but it says concisely the fact that the hard part is getting the seniors to show up, right? Anybody can get plan an event and get guest speakers and get vendors and all this other, and you're all staring around looking at each other. I've attended some health fairs that were kind of sad where vendors were selling to vendors. The secret is you have to get the seniors there, right? So you want to select a venue. That's the first part. They could easily handle about 200 seniors arriving during a 4-hour period. The total attending from your 1,200 general mailers should be about 150, and that is all depending on how well you market it. And you would want to pick up an additional 50 attendees through direct invitations, through your sales force going out and marketing the event, and from the event site itself. So you'll want to designate 5 different areas for your on-site event. You'll need a welcome station and there you want to make sure that the seniors qualify for the annual wellness visit. You want to make sure that they're doing their pre-screen questionnaire before they enter the screening station. You want vendors there, so you need vendor stations. You have distinct examination areas. Remember, this is a hands-off consultation. That's just somewhere where someone can ask questions of a practitioner. The general seating and eating area, and the post-annual wellness visit consulting area or consultation area. You'd want some of your vendors to have access to that because some of their services would be needed. So this is just an example of a layout that we suggest. You would see around vendor stations, open seating in the middle. You'd have your welcome station, a couple of examination rooms, and your post-annual wellness visit education place. And this would be multiplied by a count of 4 or so if you were going to handle 200 seniors within a 4-hour period. So here's a screen that everybody seems to like, and it's pretty popular. You can pull off this event with very few costs by using vendor station and co-sponsors. See all these vendors, you simply charge them, right? A co-sponsor can arrive and have equal post-visit access to your attendee for the cost of lunch being provided. And you need to have a co-sponsor to put your events together too. You can look for it outside the home care arena. Some are financial providers, service providers like Prudential, Merrill Lynch, Wells Fargo, or it could be on the long-term care insurance side, MetLife, Preventa, those type people, or any other service provider local to your community. And you would want vendors, local drugstores, DME, podiatrists, residential care facilities. Anybody that needs the same senior audience and needs to market to them could be a vendor. 12 vendors being charged $235 each can cover the cost of your event kit, which includes all your upfront costs. You could have a co-sponsor that their only contribution is the food or snacks, and it's paid for. So, like I said before, track your return on investment. Now, if you've already got it paid for and everything, hopefully this will manifest itself, and you're going to do this at least annually and sometimes quarterly, depending on how successful it is. Track your marketing results and then repeat this strategy at regular intervals. We can target different zip codes. We can reach a different audience once a quarter. And what you'll see is there's a collateral buildup as the seniors become aware and looking forward to annual wellness visits, and they see the value in it. Right now, most of them don't know about it, so we're in the education phase. But once they've done it the first time, you're going to bring them in over and over and over again. So here's our components of our annual wellness visit kits. It's the mailer letter, which explains the benefits, but it also has the initial questionnaire, and there's a couple of options there. And then we have separate on-site questionnaires for people who aren't bringing their mailer in or need to redo it. And then there's the clinician's check sheet, what has to happen during the visit, that is listed, and then the copies of the women's and men's preventative plan, or the PPPS. Okay, here's the bonus offer. If you get the annual wellness visit today or within the next 14 days, let me tell you, it's a great time to do this. This is why we scheduled this webinar exactly right now at the end of November, because we know the holidays are going to be out there. You can't outspend your competition to get their attention during the holidays, but if you choose to, go right ahead. I can't stop you. If you want to get a bigger, better basket, if you want to put hams in your basket, or I talked to one lady last week. We had this discussion. She was going to put pineapples. You know, have you told everybody that, Eric? Pineapples aren't that expensive, and it looks like something really big. I'm putting pineapples in all our gift baskets for giving our referral source. So go ahead and do that. Spend all your money through the end of the year. Call me up if you want a return on investment, okay? Because we need to get serious about it. There's a lag at the end of January into 1st of February every year. The holiday season, everybody has spent all their marketing money on pineapples or Santa Clauses with jelly beans up there inside their orifices or whatever. But you can put your money into something that has benefit associated with Medicare in a preventative way, and brand yourself through an event that you can actually track your return on investment. Now, when I asked the lady about the pineapples and how she was going to track how well that brought in business, she couldn't really give me a straight answer other than people like pineapples and it looks like a lot. What I want you guys to do is I want you to start planning now. I want you to pull it off late January, early February, when there is no noise left in the territory. In other words, you couldn't get the attention of a referral source now if your life depended on it, because the holiday season's coming and everybody has such a really strict social/marketing schedule that a lot of money has been thrown around to referral sources. I want you to hit them when you're the only voice in the woods, and that's in late January, early February, all through February, as a matter of fact. February is one of those magical months when we start taking ourselves serious again, and everybody's usually on a diet and worried about heart health and other things. So it's a great time to do an annual wellness visit. If you do that, within the next 14 days, you call us up. We'll talk to you about whether it'll work in your territory or not. You'll get these free pocket protectors. They're great. You're going to be exposed to the Medicare benefit, Part B benefit cards anyway at the event. And what you could do is put a pocket protector with and brand your home care services along with their pocket protector. Because if they like you, you want them to love you. And if they love you, you want them to become advocates. And the way to do that is brand yourself with these pocket protectors. So that's it in a nutshell. That's the annual wellness visit events. Of course, we still have a lot of coaching collateral. We're still rolling out our Power Plays. Home care is a week-by-week guide for home care sales reps. They're only $97 through the end of the year. They'll go up after the first of the year when people actually start realizing they need them. Thousands of dollars worth of collateral and wrapped around about $1 million worth of ninth grade genius strategy. All different things that you could do or should be doing associated with the time of year, national observances, best practices, things like that. So now I'm going to put up my contact screen and answer a few of the questions that come in. Good friend Rob in Chicago congratulating me on my music selection on the lead-in. It's more to do with Nick, although I concur. That's some pretty cool music. Eric, is there any way we can see samples of the annual wellness visit components? Yes, there is. Just email me at eric.crump@theadamgroup.com, or you can call in and speak to Rebecca at 1-866-232-6477. She'll send you samples out, some physical samples to you. And remember, you're going to get copies of this presentation, so you'll get some of the look of it for that. Got a question, do the physicians bill Medicare for the AWV? Yes, they do. That's a GO code. However, if you're a Medicare Part B provider and you're lucky enough to have physicians working for you, you bill for it. It's going to get me on another tangent, but trust me, I think all home health agencies should be looking for physicians to start doing in-home visits. It just makes sense. It's even more profitable than our nursing business. Why wouldn't we do it? Also, certified diabetic educators, stay on top of where Medicare is leading us and be progressive in your thoughts. But yes, that's a physician's bill code. Physicians bill that one. When will we have the slides available? Usually within 48 hours. It'll be by the end of the week. Nick usually sends them out the next day. He does a great job. Nick Pastana, some of you have met him in our live presentations. He's the wizard behind the screen that makes all this work. I love you guys too. I got some of my peeps out there sending me some stuff. How is the billing possible if they aren't the patient's primary care physician? It can be done by anyone, any physician. Just like how is billing possible for them to go to the ER, or how is billing possible for them to go to all the wellness clinics that are popping up everywhere, every drugstore, every grocery store. The truth is, primary care physicians are concentrating on managed care programs. That's where their money is, the management of chronic disease processes. However, you can get personal care physicians to conduct your annual wellness visits, and of course they would bill for them. It's a good way to solidify those ties, or to bring out those referral sources from out away from the several layers of gatekeepers they have now, and you can't get in touch with them. Do the Advantage plans charge for the annual wellness visits? No, but I don't think they're apt to doing them yet. This is such a new service that they haven't caught on. Some of them may have caught on. However, I guarantee you when Advantage programs start facilitating these events and these annual wellness visits, they're going to take credit for the fact that there is no copay. So if you can read between the lines, that's what I'm telling you. We need to go out and market direct Medicare services more. Here's the question I've been waiting on. By providing the physicians with forms to fill out for these wellness visits, can this be considered remuneration and in violation of STAR clause? Yes, it can. You cannot give a physician something of benefit and expect an immediate return for a referral. So if you have a physician that you're currently getting business from, you're going to have to show them the amount of money they can make and charge them for the templates. And we separate that out for you. It's about $250. So they break even on the template side in their first two consultations. But yes, it's a very good point. We can't induce physicians into giving us referrals by providing something of value over and above the limits. This was technically would be beneath the limit of the $355 per physician, but I always suggest that this be introduced to the physician as, here's the tools to get it done. We can facilitate these tools for you, but you're going to have to pay for them with fair market value. So that's a great question. I'm glad it was asked. Have you heard of primary care doctors getting upset with the annual visits being already billed at our event and they cannot do this for it? No more than they're upset that their patients go to emergent care visits or clinics instead of coming back to them for their chronic condition management visit. But yes, I could see where a physician could try to make the case where they're losing business because they're trying to say, if I can't see them, nobody can. But the truth is, they aren't going out there and getting their patients and giving them annual wellness visits at this point. And what your message to all general practitioners is that when we do annual wellness visit screenings, a rising tide lifts all boats. In other words, you're going to get more business because we're going to take them back to you, and we're going to make all these chronic visits, they're going to be more compliant with them because we're going to set up these visits with the general practitioner. We're going to give the specialist more business because we're going to set up all these screenings and labs and specialty visit consultations. So annual wellness visits, just through the purpose of conducting them, brings more business into the community healthcare than it'll ever take away from it, right? And that's your message back to the GPs who, for whatever reason, are, even though they're not providing this service, are bitter that you are. If we're referring physicians bill for the service, won't they view this as a competitive event? If they're billing for the service on an individual, they don't qualify for your event. In other words, if they've had their annual wellness visit already, then it has to go 12 months before they could ever have the visit again. But this is the argument you guys are making, and Medicare has, in its guidelines, even mentions these type of initial or changes in beneficiary screenings aren't meant for people who are compliant with their general practitioner. These are meant to bring in people who are outside the norm healthcare model. These are to locate not the people who follow up and make all their appointments. These are to bring in those people who are most at risk, who don't know best practice, who don't follow the regimen that a general practitioner would give them. So I would tell you that tell the physician, the general practitioner who sees this as competition, to say, get ready for all the patients we're going to refer to you. Once they identify that you're their primary, you're going to get a visit from them in 30 days because that's going to be the best practice that they leave with. We're going to take your periphery patients out there who aren't coming to your visits or who are scheduling appointments and missing them anyway and bringing them back to the fold, right? We're getting all the outlier patients and bringing them back to your business. So if you think this is competition, think again. and get ready to open up a new office for all these referrals we're going to bring you from our annual wellness visits. That should be the message. What percentage of annual wellness is unbillable due to patient not being eligible? I have no idea, to be quite honest. There's going to be a percentage, just like with flu shots, when we used to do the flu shots. If we're not running through the Medicare Common Working File and clearing the number before we provide the service, then there's no guarantee that they've been on service for 12 months or that they haven't had an IPPE, Welcome to Medicare physical or annual wellness visit a year before. I would conjecture that the percentage would be fairly low if they're filling out the pre-screen and they realize that if Medicare doesn't pay, then and the service was provided. If they don't qualify, if they don't understand the prerequisites of Medicare payment, that they would be on the hook for it, then I would say that the percentage is going to be very low. Okay, I got a couple more questions I'm going to answer, and I'm here, right? I'm not going anywhere. It's raining outside. I might not even take lunch today. So I'm going to read a couple more, but email me or call in. We can answer your questions. And again, the PowerPoint slides are going out probably within the next 48 hours. And again, it's worded a different way, but how would you know if the senior hadn't already had their AWB for the year? You know this year because it just started in April, right? However, in subsequent years, you would have to either run the Medicare number through the Medicare Common Working File to figure out whether or not that charge has been billed to that patient's number. That's the only fail-safe way of doing it, and you guys have access to that. But in reality, it's not your problem. It's the billing physician's problem. The same way that he has to make sure that he's not using the same primary codes for billing within the 30-minute limit on follow-up visits back into his office. Physicians know how to bill this and clear the numbers, right, on the GEO code. So it's not that big a problem as you think. Okay, guys. I appreciate it. I went a little long, about 20 minutes long today, but I really enjoyed it. I enjoyed talking to you guys, so give us a call. I'm going to leave up my contact information. Again, if you need information on annual wellness visits, you need samples, you need to get started right away, we're here for you. Call 1-866-232-6477. I'm known for answering all my emails, so you can email me. I'm going to leave up the contact information for the next 5 minutes. But go out there and tell our story. Tell them how great and how home care services is the most cost-effective way Medicare spends a post-acute care dollar. Because that's the truth, people. You go out and tell that story and have a great day.